to Parent Solution. Today we have here with us Dr. Mark Bertin. Welcome, Dr. Mark.
Thank you so much. Good to be here. How are you?
I'm fine, thank you. Dr. Mark Bertin is a developmental pediatrician, and he is author of many books and also assistant professor at New York Medical College. And today he's going to talk about the new updated milestone of development. So tell us about it, why it is important for caregiver to know about milestone in developmental milestone in children.
Well, I think we can just, you're sort of asking two questions there, about milestones in general and then the update. And really the update is just sort of adjusting the expectations based on research and some other statistical changes. And I can touch base on those, really, but the more important concept, I think, is just understanding why it's important to see that children do tend to follow a typical developmental path. My understanding, I've been practicing a pretty long time now, but my understanding is actually it's only been about 40 or 50 years that there's even been a consensus that there is typical development. And basically what we see across various aspects of early childhood is we want kids to be kids, and we don't want to set unrealistic goals, and some children are going to develop at a different pace than others. And yet within that, there is a typical unfolding of development across multiple different aspects of childhood. And the reason it's important to be aware of that is primarily to support those kids who might be falling behind in one of those areas. Because the earlier we intervene, the earlier they're likely to catch up. In fact, it's sort of almost changing a trajectory of development sometimes. So the most common milestones people are aware of are probably markers like around language, where we know kids usually say their first word roughly by their first birthday, that sort of milestone. And then motor skills such as walking, but there are several other paths as well that we can be following. There are skills that have to do with social and play development. There are skills that in another podcast we've talked about having to do with a skill set, for example, called executive function, which are like your self-management skills, something that's very new science that we know that these develop at a very gradual rate, actually, until kids are all the way in their mid-20s. But the bottom line is that as frightening, as upsetting as it can be when children fall behind, we don't want to be avoiding that, because so many of the interventions are just educational. There's no downside to doing them. And we just want to get them in place as soon as possible so that someone who's speaking late or someone who is having some difficulty with play gets supports when they're very young. And that's the basic framework for why we define these developmental markers, and why hopefully most children are getting some sort of actually structured screening through their pediatrician regularly to help detect those changes or detect those delays earlier.
So what are the new changes in developmental milestone?
Well, what happened was, the milestones get updated periodically, not all that often, but they get updated periodically. Some based on research and some just based on our understanding of the field. And the primary thing that actually, I think there's two changes. By the way, we're recording this in 2023. It's actually not that new anymore. They've been out 3-4 years at this point. But the changes were primarily in two areas. One is statistical, so it's a little sort of wonky to try to talk through it, but basically where the old milestones, there were all these checklists and things you can get, were based on the idea of trying to document what the average age someone developed those skills are. They've shifted it now to the 75th percentile. So the way it's summarized, it's like, instead of average for age, they're saying most children have done it by this age. And what that does is kind of shift everything, or not everything, but shift many skills just slightly later. So like one of the language-based ones, for example, is it used to say most children by 9 months, excuse me, it used to say children should be understanding the word no by 9 months of age, but when they looked at all the research, what it showed is that that's average. And instead, for screening, it's easier to understand it by saying by a year of age, most children will do it. So now it says 12 months for that skill, meaning, much past 12 months, you have to start wondering why someone isn't doing that yet. So for multiple skills, everything shifted a little later, sort of as a way of raising the bar just a bit and saying, like, if you haven't done it by now, maybe it's time to start thinking about why this isn't happening or starting to get an evaluation done through early intervention. And then the second thing that they did in the revision of milestones is adding more social emotional markers of development because that's been such a huge uh, area of research. So it's trying to really nuance when to look for different social delays, basically. So those are the two big changes in the updated milestones. Although in the big picture, the overall framework is very similar to how it's always been.
Okay. As a developmental pediatrician, what do you suggest to our viewers? What are the main areas to look at in development of a child? What are the main areas we should focus
Well,
on?
there's so many, but I think there are first of all, as a parent, I don't want anyone having to feel like they need to be doing this themselves. So I'd almost start with, your job as a parent is be emotionally available, supportive, and set up an environment that encourages learning. Um, and then if you have any concerns, go to your pediatrician or somebody professional to actually do um, the overthinking about everything. So I don't want parents doing too much of this on their own, except going to their pediatrician when they have concerns. When you look at areas of development, um, there are a bunch of different ways of looking at it, but typically we're breaking into several different kind of skill sets. Life is way more complicated than this, by the way. It's sort of an academic model to break them into such separate skill sets. But broadly speaking, there's social, emotional, and play skills is one path of development you can monitor. Really knowing that most kids are very socially engaged and interactive way before their first birthday, like really during their first year. There's a lot of social engagement, there's a lot of social back and forth. Social skills also um, overlap a lot with play skills, and then we can follow. So in parallel to social emotional skills developing, we can look at play skills and see things like imaginative play developing when kids are just after their first birthday for most children, and more engaged play with other children developing, sort of more towards preschool age. All of that is part of social emotional and play skills. There's a second skill set that has to do with language and communication that's very commonly monitored, um, fine motor skills, gross motor skills, and then, like I said, self-help skills, which some people sort of lump in with fine motor skills, some people separate out. And then, in its own way, you can look at this executive function path too, I think, which has to do with self-management skills like, attention and emotion and things like that. So that's a good, those are any book you get on general pediatrics as a parent will sort of outline those different aspects of development.
Okay. One very important question which often comes in my mind is mental health of a caregiver going to affect on a developmental development of a child?
Well, that's a much more nuanced question than it seems, obviously. I mean, I think um, children need adults who are consistently emotionally there for them growing up. And at the same time, everybody has their stuff they go through, and you don't want to be caught up in a situation where you're both struggling in some way with mental health as a parent, and then also, consumed by fear and guilt. And it's like it's not fair or appropriate. I mean, we just have to take care of ourselves as parents too. So I think obviously in extreme situations, a parent's mental health can certainly impact the whole family. But most of us as parents have our difficulties at times also. And as long as our children are getting their needs met, I think they're going to be okay. So, I think we have to sort of look for that balance of, you know, there are always going to be extremes in life, and there may be situations where we need to look for ways to keep our children supported during those extreme times. But for the rest of us, I think the imperfections of life are just what, like we're all going to have those moments in time. We're all, I mean, imperfections is a pretty gentle word to be using for some of the struggles many of us have.
Yeah.
So, if you're struggling as a parent, obviously there's a lot to be said for seeking your own supports and trying to take care of yourself however you can. But most kids, just need to be getting their basic, they need their needs met emotionally and otherwise. And I think, that they're going to be okay as long as those things are true also.
Okay. Thank you for sharing all this with us. One last question. Give us few
Yeah.
tips to give best development to our children.
Ah, I don't think you can. I mean, I've written a lot about how to support development in children, so I don't think I can give. I don't think I can summarize all of taking care of children in a nutshell because that isn't fair to parents or kids. But
Yeah.
some of the basics that support. We'll talk about early childhood. They certainly start with just the emotional part of things that I was just alluding to. I mean, kids need to feel emotional consistency, and they need a sense of, a positive environment overall. Although I would say that that can get taken to an extreme too. They need that balanced by some clear boundaries and limits at the same time. But there's the environment they're being raised in, and that's the stability of that environment and the emotional consistency goes a long way. Um, I think I would just, since I was asked to keep it short, I think it would be probably timely to comment on a study that came out just this week looking at how in early childhood, more screen time correlates with developmental delays. So basically, in this modern world we're in, I think it's important to understand, especially in younger children, that the just day-to-day interaction with adults, talking to adults, the sort of nonsense speak we do back and forth with our kids, all the person-to-person interaction, reading books with kids is incredible for the development. All the language-based stuff we can do as an adult that's actually off-screen and individual is incredibly supportive to their social emotional development and their language development. Both of those skill sets, by the way, are direct early social emotional skills, early language skills correlate actually with school success too. So that is, really, really foundational. And in our modern society, one of the most important ways to facilitate that is by really limiting and cutting back on screen time as much as possible in early childhood. And that I think is, really the message of that new study that just came out. It's one many of us have been promoting for a long time. There really is no, and there's nothing wrong with, like, as kids get older, and there's an argument in younger kids, there's some argument for almost none. As kids get older, you can use it for a little break once in a while as a parent, but there isn't much benefit to screen time beyond that otherwise. So anything we can do to, um, promote free play, open-ended play, creative play, reading books, one-on-one time with loving adults, that's the sort of stuff that promotes development in early childhood.
Okay, thank you so much for everything. And I want all my viewers to go and reach out to Dr. Mark Bertin through his website, which I'll be putting in the description link. Thank you, Dr. Mark. Thank you for being here with us.
Thank you. Thank you for the invitation. Have a good day.
Have a good day.